Going to the doctor and getting our blood drawn is a routine part of many of our lives. But what happens to our blood after it is collected? I would wager that the majority of you in attendance here today don't really have an answer for that. What happens to our blood after it is sent to the lab? How do medical providers get the answers and data they need from our specimens to properly diagnose us? My aim today is to educate, inform, and hopefully inspire you to be more curious about the hardworking medical laboratory professionals who are running these tests behind the scenes. To start, we'll delve into the many different types of practitioners who work in medical laboratories. Once we understand who, we can focus on why laboratory medicine is important. And finally, I will impart some of my personal experience and that of my lab colleagues on why we love what we do. According to a study performed by the University of Kentucky, the majority of Americans have no idea who medical laboratory professionals are. It's called the hidden profession, and oftentimes the unsung heroes of healthcare. But who really are the people running your lab work? For starters, there are many different types of people who work in the lab. We have phlebotomists who collect blood from the patients, specimen processors who receive samples into the lab and prepare them for testing, and finally, the medical laboratory scientists and technicians who are performing the testing. Most people who work in the lab have either a 2-year associate's degree or a 4-year bachelor's of science in either medical laboratory science or in a related field. For example, I received my bachelor's of science in biomedical laboratory diagnostics from WVU, which, for my family, has always been a bit of a mouthful to say. After that, I sat for my Board of Certification exam through the American Society of Clinical Pathology. And finally, I applied for my state licensure through the West Virginia Department of Health and Human Resources to be able to practice laboratory medicine. Furthermore, our work is not just defined to the hospital setting. Medical laboratory scientists can and do work in many other facets of healthcare, including, but not limited to, medical research, forensic science, information technology, and education. So now that I've given you a brief explanation about who medical laboratory scientists are, it's time to focus on why our work is important. We have a bit of a saying in the lab that without us, your doctors are just guessing. Now, that may be a bit of an overstatement, but the fundamental point is that we provide quick and precise results to aid in diagnosis. Now, currently, you may be asking yourself, what kind of testing would be so important for medical providers to use to diagnose their patients? Well, allow me to enlighten you on some of the testing we offer at WVU Medicine. Yeah, that's a lot of tests to know how to perform, remember to do, and interpret. To highlight some of the more important areas of the lab, we have chemistry, which will run your lipid panels, basic and comprehensive metabolic panels, and tumor markers, to name a few. Then we have hematology, which focuses on complete blood counts, coagulation testing, body fluid and urine analysis, and bone marrow biopsies. Our final 2 core sections of the lab are microbiology, which grows and identifies bacteria infecting patients, as well as virology, and the blood bank, which processes donor blood products and tests their compatibility to the patients. So that means that at Ruby Memorial, where I work, we're the lab for everyone at the main hospital, Children's Hospital, Cancer Center, and the Heart and Vascular Institute. But what would we do if we didn't have these laboratory professionals to run these tests? How would doctors and nurses monitor a patient's disease progression? How would we diagnose our cancer patients? Or how would we give blood to patients who are bleeding out? According to the American Society for Clinical Laboratory Science, current projections of medical laboratory personnel through 2030 are insufficient to serve medical services effectively. To me, that is frightening. Aside from working in the lab myself, I, like many of us here today, I'm sure, have had family members who were sick or diagnosed with cancer that required a lot of testing, blood transfusions, and treatment. Without our unsung heroes of healthcare, the people who will ultimately be suffering are the patients and their families. Currently, you're probably asking yourself, Who would want to work in a lab? Who would want to do a job Who would want to do a job that offers little recognition or appreciation in regards to other health professions? Who wants to work in a loud, oftentimes windowless environment just to be thought of as a lab rat? For me, it's about making a difference. It's about giving people hope, serving the patients, and helping their care teams give them the best treatment possible. All healthcare professions are often thankless, requiring long hours, years of schooling, and less pay than is deserved. And yet, we do it because it's rewarding to be a part of a team, to dedicate yourself to helping others. Originally, I was a biochemistry major. I had a plan of going to graduate school and working in an industry lab somewhere. But the further I progressed in my studies, the less fulfilled I felt. I knew I was passionate about medicine, but I loved science too much to give up my dreams of working in a lab someday. So, like many of you today, I learned about medical laboratory science for the first time at age 19. I was hooked. Once I was accepted into WVU's program, I felt enthusiastic about my studies again. I met some of my best friends, and I felt fulfilled by what I was learning. But most of all, I found my purpose. Now, 4 years after I've started my journey, I love my job. Sure, it has its ups and downs like any job would, but I love knowing that I'm a scientist, that I work with some of my best friends, and that my grandfather, who was a physician, would be proud that I'm working in medicine and making a difference. Because when I'm looking at a patient's blood smear or working up their testing, for that brief moment, only I know their probable diagnosis. And that's when I know that what I'm doing matters. To conclude my TED Talk, I want to leave you with a quote by the incomparable Marie Curie. A scientist in their laboratory is not a mere technician. They are also a child, confronting natural phenomena that impress them as though they were fairy tales. I hope that through my speech, you've learned who medical laboratory professionals are, why our work is so important, and hopefully ignited a curiosity in your own minds, not just about science, but about your own medical history as well. I feel fortunate to be able to showcase not only my profession, but the profession of so many other hardworking individuals who work in the field, and for the support of my friends and family in learning and understanding what it is that I do. So the next time you go to the doctor and get your blood work drawn, I want you to take a minute and think about the hardworking medical laboratory professionals who are running those tests for you. Because now, you know doctors, nurses, therapists, and pharmacists, but hopefully, you know medical laboratory scientists too. Thank you.